So welcome everybody. I just want to first of all say again, thank you for coming tonight on this International Women's Day and this important discussion on maternal health. And this is a day we celebrate women and around the world. And we acknowledge that there's a lot of bittersweetness right now. I mean, we just even think about what's happening in Ukraine right now with, especially with mothers and children having to flee, and with the whole refugee crisis that is now starting there. And we're also thinking about what's happening in East Africa. That's where we are based. And we know that we have come so far and women have come so far in terms of health, access to education, work, and just simply being valued. But we know there is still a long way to go. My name is Denise Lottie Roberts. I'm the Communications Director for Save the Mothers, and I will be your moderator tonight. You can see our other participants here. We have another one coming. And I know many here are familiar already with Save the Mothers and what we do, but I first just want to present a little bit more about us. I'm going to share my screen. Okay, just sharing my screen, just making sure you guys can see this. And yes, let's get started. Okay. Sorry. Okay. So Save the Mothers is an international charitable organization. We equip African leaders to save the lives of women and babies. We are based in Uganda at Uganda Christian University, where we train professionals from all walks, including education, politics, law, media, and faith. And we take them through a 2-year Master of Public Health Leadership program. And our other major initiative is to improve the standards of care for mothers and babies through our mother-friendly hospital initiative. And why do we do this? Oops. We do this because 15% of all pregnancies everywhere will develop a life-threatening complication. Every 2 minutes, a woman or girl dies from these complications. That is more than 300,000 deaths a year. And less than 1% of these deaths occur in developed nations, which is probably why so many of us don't hear much about maternal deaths. Meanwhile, the likelihood of a woman dying in sub-Saharan Africa is 1 in 37. And the biggest tragedy of all of this is that nearly all of these deaths could be prevented. So that leads us to the question that we are going to be discussing tonight. How do we address maternal health inequality? And joining us to discuss this question is Dr. Chamberlain Froese. In fact, we would not be here tonight if it was not for her. She is the co-founder of Save the Mothers. She founded it in 2005. She's an obstetrician, director of the International Women's Health Program at McMaster University. She worked as an obstetrician in Yemen, Zimbabwe, Zambia, and Pakistan before establishing Save the Mothers in Uganda, where she served as executive director until 2017. She received the Order of Canada in recognition of her commitment to saving the lives of women and babies in the developing world. We also have with us tonight Dr. Sarah Schachoski. She is a female pelvic medicine. She specializes in female pelvic medicine and reconstruction surgery. She worked several years teaching in a rural Kenyan hospital and at a New Mexico Veterans Health Administration, where she studied sexual trauma and pelvic pain. She has repaired obstetric fistulas with colleagues in Kenya, Malawi, and Burundi, and she is currently an associate professor at Oregon Health and Science University. And Dr. Shaun Gillis is joining us. She is a board-certified obstetrician gynecologist based in Bozeman, Montana. She is the past president of the Montana Medical Association and has been active in the American Medical Association, both of which provided her with experience in patient advocacy. And we are thrilled because she is also the chairperson of Save the Mothers U.S. Board of Directors. So we want to hear from you tonight. We are having this as a panel discussion, and during that time, our participants will be muted, but we will be having a question and answer period afterwards. So while the discussion is going on, please Submit your questions in the chat. Just click on the chat icon at the bottom of your screen to indicate whom you want to answer your question. And the chat won't be public, so don't be shy. You can ask anything. But before we get started on our discussion tonight, I wanted to give the first word to our director in East Africa, Dr. Miriam Mutabazi. She, due to the time difference, it's currently 3 a.m. in Uganda right now. She was not able to join us live, but I did ask her to give us the opening remarks, and she was very happy to do so. I apologize for the grainy quality of the video, but you should be able to hear her well. Here is Dr. Miriam.
Hello, everybody. I'm Miriam Mutabazi. I'm the Executive Director of Save the Mothers, East Africa. I'd love to wish you a happy International Women's Day. In Uganda, we celebrate the Women's Day, International Women's Day, as a reminder of how far we have come in terms of fighting for the rights of women. We live in a culture that has nuances of women being inferior. And so for a long time, we've been missing out on the rights of the woman, right to health care, right to owning property. Even our children don't belong to us. But we thank the Lord that education and global exposure has opened a window of hope so that we now have access to education, access to knowledge and information, and women have risen in ranks, women who are medical doctors, women that are lawyers, women that are politicians, women that are business women and are very successful. So International Women's Day is a landmark day where we celebrate each other and acknowledge how far we have come and look around to see how much more can we do for each other, especially those who are not as lucky as we have been to get an education. So it is a time, especially for those of us who are in maternal health and child health care, to look around and see what more must we do to help our fellow women to get good health care, respectful and dignified care when they come to the hospital, enable them to reach the hospital, raise awareness in the community that women have a right to health care, quality health care, not any old health care, and that our children have a right to survive even the rigors of labor. So this is an opportunity always to take stock of how far we have come and what needs to be done. So I pray that you can join us in this struggle. The struggle continues, as the saying goes, but we have seen good fruit coming out of our struggle. I wish you once again good deliberation over this International Women's Day. Thank you.
That was Dr. Miriam Mutabazi, and I want to now just go right into our discussion. I just have a note, Dr. Jean has had a bit of a family emergency, but she will be joining us. She will be coming into our discussion in a few minutes time, so just hold on for that. But let's first go to our doctors, Sarah and Dr. Shaun. Thank you so much for joining us tonight, ladies.
Glad to be here.
Glad to have you. Well, first of all, we're discussing maternal health equality. I think it would be helpful if you guys could just tell us what exactly is maternal health? How do we define this?
I would say the care of women during pregnancy, during delivery, and for at least several months, if not a full year postpartum. It's a very special time in a woman's life. It is also a very risky time in a woman's life. And I think that, the healthcare that is needed in this time is very specialized. It's not the same as even other times of their lives. their healthcare. So that's what I would say. What do you think, Sarah?
I think the only additional thing I would add is that the pre-pregnancy time is also a time where we want to optimize health outcomes so that a woman enters the maternity period healthy and ready to carry a pregnancy with all the nutrients and support and resources so that she can access the things she needs during pregnancy. And then along with that, I think breastfeeding is one other big topic of maternal health that we often lump in this time period as well. And, that can extend sometimes as long as 2 to 5 years after delivery, especially in countries where there's limited resources for neonatal nutrition. And so there's specific needs during that time as well for the women's body to be able to provide what she needs to for the newborn.
Great. Well, both of you have careers in maternal health, and what got you interested? Where does this journey begin? Dr. Sarah, do we want to start with you?
Sure. I would say it began at more at a college level. I knew I had some interest in medicine, but during that time, I was able to live in Uganda actually for 6 months in a small village. And I lived with the first wife of 3. And so by community standards, she was sort of the wealthy, more privileged wife. But I learned a lot from this communal-based living and the hospital that I was studying malaria at. I had not really understood sort of the sacrifices women gave, both physically and emotionally, financially, in all aspects of their life for their families. Even though I had a mother who was very generous and very giving, I think I didn't understand the toil that this took on many women. And then seeing these women in conditions where there was less support for them, less resource for them, less access to education, to resources for their children, where every sort of step in that journey of being a mother and providing for their children was a daily struggle. So that piqued my interest. And then it continued through medical school. Actually, when I rotated in Montana as a medical student with a general OBGYN who had just a great practice and who had great relationships with his patients, and seeing how close you could get to patients and what a privilege it was to be in sort of this intimate time period in their life really led me into a residency in OBGYN. And then that continued when we worked in Kenya. Although during that time, I realized I really liked the surgical aspects of maternal care. And so ultimately ended up doing this fellowship in urogynecology or reconstructive surgery.
Great. Shaun, what about you? What made you get into maternal health?
I was a little late getting into it because my focus for most of my college and graduate school was with infectious diseases. And so I assumed that would be a natural fit and that would be where I would find my niche. But turns out after I saw my very first delivery during medical school, some sort of a crazy switch flipped. And I literally thought to myself, I cannot live the rest of my life not doing this. Like I couldn't even imagine anything else in medicine being so interesting. And it's not even just the maternal health, like Sarah mentioned, there's so much to it there because we see patients as a general OBGYN. I see patients in all stages of life. So I get to meet them, in their teenage years and then carry on into, potentially childbearing years and then into, menopause and beyond. So I agree. I do feel like it's a privilege and to be able to be in those moments of women's lives where they're willing to let you in and want you there. I mean, it's pretty exciting. It's very fun. And I just haven't found anything in medicine that has been that special.
Well, when I was sharing some of the information earlier, one of the things that came up was that there are risks to pregnancy and childbirth. And I think for so many of us, we take for granted that everything just runs smoothly and without too many problems. We see babies born all the time and it goes well. But what are the complications that we're talking about?
So the main complications are, sort of the top 3 are really hemorrhage, during labor. And we have a lot of things we can do to manage that. And in the United States and in Canada, we do. It's not, I don't think people go into childbearing thinking it's a seriously risky situation. But women around the world know for sure that it is. And obstetricians know that it is as well, because we see the complications, but we have a lot of ways to deal with them so that it doesn't end up, for the most part, being life-threatening. But maternal hemorrhage, preeclampsia, and blood pressure issues are also significant, as well as maternal infection. And all of these things not only impact the mom, but the developing baby or baby being delivered and immediate postpartum period. So those are the risks that we see. I was going to have you show, can you share the picture of a Ugandan OR?
Yes, I thought this was really interesting. I'll go to my sharing my screen. Bear with me here. I'm going to just click through this. I'm just going to click through some of your pictures here. Okay.
Oh, maybe.
Do you see them?
Yeah.
Okay. Just want to make sure.
So the next one I think is probably.
Yeah.
So that's my OR. That's where I do my C-sections in Montana. And it's a pretty standard, I think, looking obstetrical operating room, fairly state of the art. And then let's look at the Ugandan OR.
Oh, yeah. There we go.
So that was from my trip in 2018. And I just remember thinking that it felt like something out of the 1960s. And then I found out that table was circa 1968. So it really is different. It's a different philosophy. It's a different approach. And unfortunately, it means that we have different outcomes. Although I'm impressed, I am in awe of what they are capable of doing with so little, honestly.
Yeah, absolutely. Yeah, absolutely. Okay, I'm just gonna come back to, and actually while I'm here, Sarah, I wanted to ask you, maybe you can walk us through a little bit of your journey. I have some slides here for you as well. Yeah, this is you in Burundi. Why don't you walk us a little bit through your experience with something called obstetric fistulas. Now, we don't hear about fistulas a lot here, but I wanted to give you an opportunity to share a little bit about your experience repairing fistulas in East Africa.
Sure. This actually is a photo in Kenya where I actually had the first exposure to fistula as a medical student. We traveled there, my husband and I. He was a dental student, I was a medical student. And I had the privilege of helping with preoperative and postoperative care while there was a fistula clinic run and fistula surgeries performed for over 40 patients. And that was sort of my first exposure to the reality that there could be severe obstetric complications that impacted quality of life. Then subsequent to that, I received extra training and completed several fistula sort of expertise, hands-on type things, so that we did fistula repair while I lived in Kenya. But then moving forward, we really saw that providing education and helping provide things like that was important for other providers who are based full-time in sub-Saharan Africa. So our family again went to Burundi to provide some of that care. I guess the methods of family planning is sort of as a back step to fistula development. And I took this picture because none of these methods looked very appealing to me based on the diagram. In fact, frankly, the condom looked the saddest. That is pretty much, which is also like the most accessible form of contraception, at least at the time while I was in Kenya. So the diagram to me also, kind of helped emphasize some of the very ground level obstacles for women to have safe, pregnancy spacing and safe family planning. This, relates to what Shaun was saying, that, this is our scrub sink for preparing for, major complex reconstructive surgeries. And there is soap and there is water, which is, tremendous. But you can imagine that in the States, most people would, if they walked into a restaurant or something and saw this as like where you wash your hands, they would probably walk out and leave the restaurant and decide not to order food. So, there's a lot of people who are doing the best with what they have. And I have to say many, many lives were saved while we were working in these locations. But transportation is one of the biggest obstacles to good maternal health. And so one of the reasons fistulas often develop is that there's delay in getting care from just the lack of, motorcycles or trucks or roads or a family member able to drive or to pay for the transportation. And so a lot of the public health initiatives have been actually aimed at sort of that step. This is training also for safe C-sections. So some of the more increased fistula rates that we're seeing is because there is not adequate training on how to safely perform a cesarean delivery. And so there's surgical complications related to that. So this is showing a Burundian resident how to safely get through a C-section, which obviously one time is not adequate to lead to a safe cesarean. But I think, the ultimate goal is a healthy mom and a healthy birth. And this is one of the women who had a healthy birth. It was preterm, but there are all sorts of very creative isolates that are made to help provide for these neonates, including ones with just simple light bulbs. Her story is good because she got access to care and there was the expertise that she needed and a safe, warm place to help her start bonding and growing and feeding with her infant. I know I digressed from many topics there, but
that's okay.
As the pictures led.
No, this is why we're here. Let me just stop my screen share.
But just one of the things I was going to say, Sarah, maybe you should explain for people who don't know what a fistula is and how they happen, at least in the developing world.
You read my mind, Shaun. That's what I was just going to say. I didn't even provide the most basic information that a fistula is an abnormal communication between two organs. So that's often between the bladder and the vagina, which would cause constant urine leakage. It can also be between the rectum and the vagina, which would cause constant stool leakage. And then there can be more complex presentations of that. In the developing world, obstructed labor is the cause. And, we have all heard probably horror stories from friends of having to push 4 hours or being in labor, 24 to 48 hours before having a baby. In these situations, the labor is sometimes 5 to 7 days long, where they're completely dilated and pushing that entire time. Or there is a young child who is provided in marriage to someone, and so their pelvis isn't fully developed and prepared to handle the consequences of childbirth. Or they just, again, have such limited resource and are not aware of what the warning signs are for obstructed labor. So the, lay birth attendant is just kind of, coaching that things will keep progressing. And unfortunately, that there has often been, death in the situation of the neonate, and then this obstetric fistula that subsequently develops for the mom. And I see Dr.
Jean.
So I feel like I should definitely stop talking because.
Oh, we are grateful that Dr. Jean is. I'm just going to get you unmuted here. Jean, can you unmute yourself?
Yes, there I am. Hello.
Oh, great. Wow, the life of a doctor is never boring, is it?
Yeah, well, I'm also a daughter too, so I do apologize. I'm literally in the parking lot of my mother's hospital here, so sorry to be joining late, but I do want to at least greet you all, and it's great to be part of the group here tonight.
Yeah, well, Jean, we so appreciate you making this time and given everything going on and also just what you have done. Like I was sharing earlier, none of us would be here tonight if you didn't have this idea back in 2005 or probably earlier that developed into what Save the Mothers is today. And I just wondered if you could just share a little bit about why did you want to get into maternal health in the first place?
Yeah, well, I think Sarah has already given the background. It's really something when you go to another country and see the injuries that women have that are totally preventable. I literally, in my entire career here in Canada, cannot remember one woman except one that had a fistula. And it was, after a result of surgery. It wasn't because of unsafe childbirth. So to see the injuries that women are having, the numbers of babies that are dying, again, I deal with mothers who lose babies here. I've recently had a few, and they've just been absolutely tragic. But in most low income countries, I mean, every woman has a story of her own or her sisters or somebody, and just the incidence, the rates of these are so much higher babies dying, and then of course finally mothers dying of pregnancy complications. Again, in my entire career here in Canada, I've dealt with one mother that died, and that was like 25 years ago now, of a pregnancy complication. And again, I'm not saying they don't happen. We did have one at my hospital about 4 years ago. Another doctor was working with, but I'm just saying how infrequent they are. And yet, I was just visiting Uganda just actually before the world collapsed, and we were up at a hospital there where Save the Mothers was working, and a woman came in, and like it was honestly, I just don't know how to describe to see this woman who had been seizing so much and not gotten the treatment that she needed, and was literally dying in front of our eyes. And I just thought, oh my goodness, like this just does not happen in other parts of the world. And so I really thought back in those, this was back in the 90s, really, that the whole idea of Save the Mothers started to get birth through, just working with other people in Uganda, people like sort of the predecessors to Dr. Miriam, but Dr. Florence Marimbi, Dr. Eve Nakabambi, and Dr. Pius Okong, who I became friends with, who's the Society of OBGYNs of Canada, and they were part of the Ugandan obstetricians. And we just put our heads together and sort of said, how do we deal with this issue? Because, you can stand in the hospital and be ready, but if the women don't come in, then, you just can't reach them in time. And so that's really how the Save the Mothers program was birthed, out of sort of saying, how do we deal with the systemic issues of why mothers are dying and not just sort of the peripheral issues. And I think, the whole COVID pandemic, it's been an absolute tragedy. My own family has been impacted by this severely, but it is such a reminder to me, Denise, that you need a multidisciplinary approach to any kind of public health issue. You need everybody on board. You need the right leaders. You need people giving the right messages. You need to have the right equipment. And I think in Safe Motherhood, we just realized those things weren't there for Safe Motherhood in many places. And Sarah has already shown you the pictures of what is available. And, no woman or her child should die of a preventable pregnancy complication. So that's really how I got involved, and lived in Uganda for 12 years and with my family, and just had the privilege of really helping to bring this group together. And I just sort of feel like I'm a cheerleader, Denise. That's what I am. I'm a continual cheerleader. That was really my job, was just to cheerlead and bring the people together. So.
Yeah, and it's interesting too, and since you started this, and in your own journey, we've seen worldwide 38% fewer maternal deaths in the last few decades.
Yeah.
But we're still not there. So what is standing in the way? What are the biggest issues standing in the way? All three of you can answer that.
I'll let somebody else answer first. I'll take it. Pause.
I mean, I think we were talking about this a little while ago when we were discussing this topic. And I think so much of it is just that in so many places around the world, women are just not really seen as worthy. I mean, they're very much subservient. A lot of times they're property. They're traded for cattle. And the other thing I think that is really tragic is it's almost normal for women to die in childbirth. And so I really do believe that until we can get the message out and share the importance that, safe motherhood really is a valuable thing. Having a mother in the home is important. Having a mother for the children is important. Dying in, labor and delivery is not, normal. And I think that's got to be, and I think that's why I was so attracted to Save the Mothers, is because you're not just standing in the hospital waiting for them to get there and then really having limited ability to make a difference on a more large scale. But Save the Mothers is all about educating and growing up leaders in their communities. And that means that the children are going to be taught in the schools. And, we've got people in Parliament who can then go and fight for women's health. So I don't know, it's a very big issue. It's like, trying to ingest an elephant. And I think it can seem very overwhelming, but you have to start. You just have to just start, and you just nibble as you can and in every way you can. And that's my 2 cents.
Yeah.
Does anybody else
Go ahead, Sarah.
want to pipe in on that?
I think that issue of normalization, that this just happens, this has always happened, is really challenging to overcome, but also so critical. And I experienced a lot of that in Kenya, even from some of the physicians and nurses and midwives that I worked with there, who had so experienced this in their life. And I think some of it is maybe a coping mechanism too, to deal with the tragedy that's around you, to sort of normalize things. And so I spent a lot of my time truthfully weeping when I first got there, because obstetrics and gynecology in the States is generally a happy field. You know, we go into it with this expectation of joy and being there during this beautiful time period. And the abrupt difference of going into a place where it was often filled and marked by tragedy, and usually that's only when I was called, is when it was going tragically wrong, was heartbreaking, and, you know, something that definitely led to really cry out to God, like, why is there this injustice and these lives I know you love and value, and how do we communicate that, and how do we start to bring about change and value to a mother and to her role in the community. And I think education is exactly what Shaun gave as the answer, and I would agree as well, whether it's educating health workers or educating women who have fistula to educate other women with fistula, whether it's educating grandmothers to, you know, talk to their daughters about not circumcising their granddaughters. You know, there's just so many different levels to attack. And I think really it's not necessarily my solution to offer, but part of what's so great about Save the Mothers is it empowers the community to find those solutions and then provides support and advocacy around those solutions.
Mm-hmm.
Yeah, I really agree with that, Sarah. And you know, any kind of social change is very difficult. Again, we've all learned how social change is very difficult ourselves. We've gone through the experiment the last couple of years, haven't we? So getting people to change how they think about certain things, their behaviors, is very, very difficult. But it can happen, and it slowly does happen. And so I think, again, it's not about us as people from the West coming from high income countries, but really from people, leaders within the country themselves. And I think that's been the strength of Save the Mothers, is really getting local leaders who understand the language, because people can easily misunderstand why you're there. If you're sort of there telling them they should be thinking this way and that way, you know, we don't necessarily take very friendly to somebody else coming in telling us how to do things. And so I think that's really been the key, is to getting local leaders. But, you know, stepping back to the kind of the bigger problem, you know, it isn't just about sort of how people think in low middle income countries, but also how we think here in higher income countries. Do we really take seriously, has the West taken seriously this plight of unsafe motherhood? And, you know, certainly in my lifetime, my career, since I've been involved, I've seen a huge change where, you know, you do have these Millennium Development Goals that have included safe motherhood as one of the, you know, 8 right from the very beginning. So I mean, there has been, you know, certainly some global attention to it, but I don't think that there's been enough. We just need to keep banging the door, because until sort of, again, the world takes this seriously, there's going to be so many other agendas. I think coming out of COVID, there's going to be so many other things that people are going to be grasping for. And I think safe motherhood needs to stay right up there at the very top. And so I think, you know, we still have that role to keep the agenda out there. And then again, just continue to encourage people in low middle income countries, like through programs like Save the Mothers, to help to bring about change, and keep at it. Like you know, we kind of joke we got the COVID babies coming now. I'm sure Sarah and Shaun know what I'm talking about. I mean, there's all of a sudden this big, huge rise in the number of babies. Well, you know, we have to have equipment for every single baby that comes through. You have to have the umbilical cord clamp. You have to have everything that you need, all of the OR equipment, whatever it is that you need. And so the same things are happening in low middle income countries as well too. They still need the equipment. And so during these times when, you know, there is going to be some economic fallout from COVID, we need to continue to make sure that the health budget, you know, prioritizes safe motherhood, so those women get the care they need. Because if anything, there's going to be more babies being born in the next little while, I think, than last. So.
And we do know, like, for example, in Uganda, the teen pregnancy rate went up during COVID
Yeah.
which
Yeah.
is very dangerous because we know that it's the largest killer of girls between 15 and 19. So so we are going to see more of this issue coming to the front. Let me just ask, what, we've heard about what's going on, but what gives you hope, and how do you see justice for mothers? Like, we've addressed some of the issues and we've talked a little bit about that, but I just want to throw that out there. What gives you hope right now, and how do you see justice for these mothers?
I guess for me, the hope I see is, I continue to see the word from some of the graduates of the Save the Mothers program. Topia Gutu, who is the communications director in Uganda, sends out this fantastic newsletter. And, again, seeing some of our graduates out in the middle of nowhere, working with what they have, and they continue to work for safe motherhood and continue to be a voice. We've had nearly 500 people that have been in this program, and they're scattered all over the place, and nobody's paying them to do the work that they do. They really believe that mothers need to be saved. And so for me, that's a real source of hope, is seeing the graduates and what they continue to do. I just really believe that, God can make a change in people's hearts, and I've seen a change in many people's hearts already. And, that centers me as well, as fast as you'd like to. But again, I think just really looking at those landmarks and those the people that have really gotten behind this cause is really just a lot of hope. And that's what brings justice, right? Is change, like people committing themselves to bringing change. That's how you're going to get justice. Us sort of feeling bad and tired and discouraged doesn't bring justice. But, again, having those people as leaders on the ground is really what's going to bring the justice.
Ladies, do you have anything to add to that?
I would say definitely there is a lot of hope. I was introduced to this whole situation when I read Jean's book, Where Have All the Mothers Gone? And it was very eye-opening. And then I went to Uganda and got to be in the classroom and see the excitement and the hunger that the students had to learn, and the things that they were able then to translate into, the one to many, where they could go and reach their community. And it was, I came away from that experience very hopeful and very much wanting to be part of it. And the other thing that gives me hope is that, when you talk to people about this program and this idea, and just even the concept of safe motherhood, people are interested. So it's not like they just blow it off and they're like, oh, yeah, whatever. It seems like whenever the discussion comes to this, there's always interest. And so people care. And I think we have to find ways to help them, demonstrate that, whether it's going there and working, whether it's financial, whether it's prayers, whether it's gifts in some other way. I think everybody can do a little something, and our role in that is to help them figure out how to translate that care into actual energy that can be used to save mothers.
Dr. Sarah?
Yeah, I would just add that we do live in this more interconnected world, and so it's not so abstract. We see the lives out there much more quickly and intimately in our own lives. And I think in seeing and reading those stories, we learn how we can be just and how we can be hopeful. And so I guess my encouragement is more to really seek out those stories, seek out stories that aren't like your own, seek out stories from people who don't have the advantages you have, and listen to them, because there is tremendous hope in reading the obstacles that people overcome to provide mothers safe care. And, I think it's also the long picture, right? So just briefly, when I was in Kenya, I trained a medical student for C-sections. He was exceptionally bright. He still is exceptionally bright. He's now running their general surgery residency program at this hospital and teaching others to provide safe C-sections as well as other surgical techniques. And it brings me so much hope to see him now in this tremendous advocacy role and as a community leader. And it's such a privilege to know that we can observe kind of the progress and the direction people's lives take when they commit to education and to serving God and in their community.
Absolutely. I think I'm going to now throw it to our Q&A portion of the night, so we can go to some of the questions that have come in. Jean, thanks again for joining us. Here's one of the first questions. So what can someone in Canada do for a mom in Uganda? It's really far away. What can we do? Or in the United States? We're both in Canada or United States. What can we do? What are some things we can do?
Well, I'll jump in, and then Shaun and Sarah, I think just being here tonight is a big thing for you to do, because you only get information by, participating in something like this, reading something, and it just gives you that energy. I remember meeting Shaun. I remember her coming up at the end of this talk that I had given, and this is like, I won't tell you how many years ago that is now, Shaun. I've had to color my hair since then.
Me too.
I'm just making the point that it's a gradual process, and so it's not going to be a quick fix. Like, you're not going to be able to do this and boom, impact somebody. But certainly, a simple thing is, Mother's Day is coming up really soon, and Save the Mothers always has some kind of safe motherhood walk. Last several years it's been virtual, but you can get like 20 of your friends to join that walk and raise some money, and then that money then can go over to Uganda and help those mothers. Now, Save the Mothers isn't kind of like sponsor a child sort of thing where you give X number of dollars and you sponsor a child. What you're doing is you're investing in the leadership of people that long after you if you remember you gave the donation, they're still out there working. So that's really the premise of Save the Mothers, is training these leaders, and they're the ones that go and touch the women. Now, there is a mother baby friendly hospital program as well too, where we do very practical work in the hospitals. But I think the real strength of, and the important part of the Save the Mothers program, the prime thing, is really this leadership development. So I think the Save the Mothers walk, Denise is I tell you, she's going to be out there letting you know about this walk. That's a really practical thing, regardless of where you are. And Shaun, I know you've done several walks where you are. Sarah, you have as well. You don't need 100 people, just 15, 20 people, but tell them all to, get their friends to sponsor them. And then you're going to start small, and then every year you can build up.
Great. Yeah. What are any other ideas about what things we can do here in North America that would help mothers in Uganda or East Africa? Well, I think Jean actually laid it out there. So anyway, thank you very much.
I would add, I guess I would say, thank you so much to everyone who joined, because clearly you were looking for more information. And just a quick little thing for those who don't know what Save the Mothers is, we've been using it very freely in the conversation because we are all very familiar with it. But it is a 2-year, and I know you did mention this briefly, Denise, but a 2-year Master's in Public Health and Leadership, and where we're training, 30 students at a time from East Africa, and those are the ones that are going out to, promote safe motherhood in their communities. And so the fact that you're here, interested in hearing more, tell your friends, share the website, say, gosh, I was at this interesting panel presentation and I heard things I've never even thought of before. Have you heard of any of this? Did you know that women were dying around the world? And definitely share with your friends, share the website. The amount of information on the website is so impressive. And you never know when you may spark somebody who decides, you know what, I just want to up and move to Uganda and pitch in teaching. You never know. There's so many ways to be involved, but really just sharing the stories, like Sarah said, and getting the information out there so that people are aware, because when we bring awareness, then we can start to bring change.
Yeah. And I will have a little bit more information coming up. Just another question I want to get to. Someone's asking, would any of the panelists address how COVID rolled back progress in maternal newborn health realm? And are any of you aware of any source that is trying to quantify this data to coalesce action? So do we know what the cost of COVID has been in terms of maternal health?
I don't think we know the full cost. I can jump in a little bit. This is more for my friends who work in Burundi and Kenya, some in Uganda as well. Some of the unknownness of COVID sparked, of course, schools being closed. And so that was very detrimental to girls' education. And there was also some return to traditional beliefs that, this was potentially an evil spirit or something that had to be handled in traditional ways. And so there was an increase in childhood marriage and girls being married off, but there was also absence of work. And so one way to bring income into your family is to, extract a bride price and to get money for your child. There was also increase in female circumcision or female genital mutilation because of COVID from our friends in Uganda because of the, which is an outlawed practice, but I think school is often a safety net for girls and for children. And when that was removed due to COVID, there's been sort of rippling effects. And please, Shaun or Jean, speak up of the stories you've heard or of the information you have.
I would just agree. I think that, being out of school and actually for a lot longer. So I'm in Bozeman, Montana. We've been back in school since September of 2020. So we weren't out all that long, just the spring of 2020. Now that's Montana. There's certainly differences around the country, and we've even seen just in our country what that's done to childhood development and anxiety and depression. And so I would agree with Sarah. The things that I've heard from friends in Uganda is being out of work, being under curfew, being beaten if you're caught outside after certain times, and just I think a level of fear and uncertainty. And you're right, it drives right back to what do we know, and a lot of the traditional stuff comes back. So there's gonna be a large rebuilding, I think, from this.
Yeah.
Yeah. And I mean, there's international organizations, WHO and some of these other organizations that will be doing massive studies. I know already here in Canada, and I'm sure in the States as well too. The Canadian government and the national governments are doing studies around the impact of COVID on pregnancies. So those will be sort of more the statistics in terms of hospitals and that sort of stuff, what came into the hospital. But of course, in many developing low middle income countries, people don't even come to the hospital. So, but the other thing I would think about too, very significantly, is actually supplies of equipment. Like even in my own hospital, and I work at a major university hospital in Canada, we literally did not have equipment for certain surgeries. We literally had to hold off on surgeries or use something else because several of our equipment suppliers were not supplying. So if we have those kinds of problems in high-income countries, you can be sure that in the middle of Uganda, the very basic stuff, the antibiotics, the equipment that they need to help save their mothers' lives, the supply chain was definitely interrupted quite significantly. So I think that's the other thing that you're really going to see too, is just the supplies. Somehow we got to get that built back up again where the chains are actually working effectively.
Yeah, absolutely. Another question we've had is whether Save the Mothers is going to be working outside of Uganda. And I know it's a very much a program. We have students coming from all over East Africa, but this is one area of the world. We know this is an issue in other areas of the world. Plans to how can we spread this?
Well, that's maybe the one benefit from COVID that I can really dig deep to appreciate, and that actually is that it's really forced the program to be more online. I really heavily believe in the importance of people meeting together in person, but it did, and we were already planning on trying to make a more online sort of portion of the Save the Mothers program anyways, for particularly West Africa. We actually took a trip to Ghana several years back to look for a university there. So I think there's definitely the plans are more to expand to other countries, and with the internet the way it is now, it is much more available. The one challenge is, again, we just take it for granted because here I am sitting in my car with my phone going, and I've got video. I can see people from all over the North America. But the challenges in many rural areas in Africa and around the world, you don't have the kind of coverage that we have, like the internet coverage. So, people can't just jump online and see, a lecture or have some sort of interaction with others. So the whole betterment of the internet is actually a big issue to try to really expand this program to other places. But I do emphasize how important it is for people to actually get together in person. I think we're all sometimes get a little zoomed out already. So you can imagine your whole program being on Zoom. I think particularly when you're talking about getting into the hospitals and that sort of stuff, people actually need the physical touch of going and seeing the sights and smelling the smells of those places.
Mm-hmm. Okay. Yeah, absolutely. Are there any final thoughts as we wrap this up? Like I said, like you said, Jean, if people are zoomed out, we don't want to make this too long, but we do want to, I don't think there's any more questions that have come through. I don't think I'm forgetting anybody here, but are there any final thoughts as we wrap this up?
Well, I just certainly want to thank everybody for coming. And I think, again, it's just a great indication of people's ongoing interest on Women's Day. I mentioned to my mother there between her puffs of oxygen that, in globally, International Women's Day is a big day. It's like the Mother's Day of many parts of Africa. So I always remember being in Uganda, and it was such a big day to celebrate women. And so we really do celebrate the gift of women, and whether we're women or men, celebrating the gift of women. And just really want to thank each one of you for participating, and hope that you'll take something from this evening and take it with you and get involved. Whether it's a walk or whatever. I'm sure Denise again is going to connect with you about that. But I really hope that each one of you stay in touch.
Yeah. And Shaun, any final thoughts?
I just agree with Jean. Thank you so much for coming and spending an evening learning more about maternal health and on the international scene, for sure. I really appreciate it.
And Sarah, just quick question. Do you have any more plans to go to do any more work in East Africa?
Yes, is the short answer, but the long answer is it's the time of COVID has made it really challenging. But I just also want to add my gratitude for those of you that listen and support and think about these things, and hope that you also still sense this deep hope that we all have, that the current situation doesn't have to be the future situation, and that a lot of work has already been done through Save the Mothers, and a lot more can continue to be done, even as we fight a pandemic and war and other obstacles in our world. So thank you for your time.
Okay, and I want to just thank all the participants. I'm just going to share my screen again, and just going to give you a few action items. We talk about what we can all do, and how can we get involved in making motherhood safe around the world. And as our participants shared, one of the biggest things is just become an advocate for safe motherhood in your sphere of influence. That's exactly the model that Save the Mothers is based on. And so you can invest in game changers. That's what we call our students. They are game changers coming through our program. $42 a month covers one course in maternal health. And we always have students who want to study and they need assistance, scholarships to do so. So we don't want to have to see any potential leaders not come through our program because they don't have the funds. Mother's Day is coming up, and as Jean said, you can organize a simple walk in your community or neighborhood. COVID has really curtailed our walks in the past few years, but we have resources to give you help. They don't have to be large events, but anything helps, any way to get the message out. And May is a beautiful time of the year to go for a walk, and even to invite your mom or someone else. And there's just so many ways that you can get involved. Shop our store for Mother's Day gifts. And one of the best things we recommend, we have two books by Dr. Jean, Where Have All the Mothers Gone? We have Game Changers, and Jean actually has a new book that's coming out. I'll be posting a little bit about that on our social media. So I don't know how she managed to write a book in the middle of a pandemic and working in a hospital, but there you go. Doctors are different than us. And you can also make a donation in honor of your mom. So Mother's Day is our big time of the year. And so any help is very much appreciated. We have all of these resources on our website, savethemothers.org. You can sign up for our newsletter to stay up to date. And I just want to say again, thank you for spending this time with us. And I have recorded this session, so if anyone has missed it or you want to pass it along to somebody, I will be posting this on our website so others can share in this. So again, ladies, thank you so much. And I just want to wish all of you a very happy International Women's Day.
Thank you.
Sure.
Take care of you.
Bye-bye.
Bye. Thank you.